5 things to remember about Haemophilus parasuis. Infections by Haemophilus parasuis are also called Glazier's disease. Those infections are ubiquitous. They can be found in every pig because Haemophilus parasuis is a commensal of the upper respiratory tract of pigs. The pigs get infected when they nurse the sow, and they can shed as healthy carriers for up to 6 months. The disease affects nursery-age pigs. The morbidity and mortality is pretty low, up to 10% in endemic herds, but it can get really high in naive herds, up to 70%. There are different types of clinical presentation for infections by Haemophilus parasuis. First, we have the peracute form, where we have sudden death of healthy-looking pigs. Then the acute form with meningitis signs. This is when the pigs are laying down on their side and paddling. They have a hard time walking as well. And we have the chronic form, where the pigs are going to show signs of lameness. We can also have signs of pneumonia with Haemophilus parasuis because it is an opportunistic pathogen. So with viruses like PRRS or PCV2 that decrease the immune response, Haemophilus parasuis is going to come and spread, multiply in the lungs, and we're going to have signs of pneumonia. So for our diagnosis, our differential for Haemophilus parasuis would be salt toxicity, Streptococcus suis infections, or F18 E. coli infections, also called edema disease. At necropsy, you're going to see severe polyserositis, so a lot of fibrin in the thorax, the abdomen, and also swollen joints. The diagnosis is made by PCR testing of fibrinous tissue, or the brain, lungs, the pericardial fluid, or the joints. Be careful because culture is inconsistent with Haemophilus parasuis. The bacteria is pretty fragile and can die out during transport between the farm and the laboratory. That's why we prefer the PCR. Treatment with antibiotics is really effective for Haemophilus parasuis, but we want to test for sensitivity first so we don't develop resistances. Cleaning and disinfection of the barn is important, and the bacteria is not very resistant in the environment.